Welcome back to Western New York Living. Now, when I say the word urogynecology, I'm sure there's few of you who have no idea what this means. I have to admit, I didn't either before I met our next guest this morning. He is one of just a very few doctors in the United States board certified in this specialty. Joining us now is Dr. Armen Kirakosyan from the General Physician PC Group. Thanks for being here, Doctor.
Thank you very much for having me.
Well, why don't you explain briefly what urogynecology is?
Urogynecology, or female pelvic medicine and reconstructive surgery, is subspecialty within the two subspecialties, obstetrics and gynecology and urology. So in order to become board certified in urogynecology, you have to complete accredited residency either in OBGYN or urology and do additional training and fellowship and pass board certifications.
What sort of conditions, what types of conditions does a urogynecologist treat?
As a urogynecologist, we actually trained to evaluate, diagnose, manage, and treat conditions of pelvic floor disorders. Specifically, most common issues that we deal on a daily basis are urinary incontinence, bladder painful syndrome, pelvic organ prolapse, complications related to prior pelvic surgeries, and mesh-related complications.
You know, some might be wondering, okay, how or why do these problems occur, and what typical age might women see these things starting to occur?
It could be many different factors that can affect and lead to these problems. To start with, pregnancy and childbirth. This is a big one because vaginal birth was proven to double the rate of pelvic floor disorders compared to C-sections. Genetic can play a role. Some women, unfortunately, have weaker pelvic floor muscles. Menopause can affect ethnicity and race. For example, Caucasian females are more prone to pelvic floor prolapse and urinary leakage related to coughing, laughing, sneezing, activities, exercises. African American females are more prone to develop urinary leakage related to urgency. Lifestyle can play a significant role: obesity, diet, heavy lifting, and smoking.
You know, some women watching this might say, okay, you mentioned coughing and such. When should they see a urogynecologist such as yourself to say, okay, to diagnose the problem and see what the treatment options are? Well,
usually primary care physicians, urologists, or OBGYNs can have a knowledge about these type of problems, and they can really be addressed effectively. But urogynecologists usually have additional expertise in these areas. So if you have troublesome urinary leakage or fecal incontinence, pelvic organ prolapse, or your primary care physician thinks that you may benefit from consultation from urogynecologists, will be happy to see you.
Yeah, there's treatment options available, right? There are hope.
Absolutely.
To correct these problems for them.
Urogynecologists can offer a variety of treatment options, anywhere from conservative to surgical options. Conservative measures usually are we start with some diet modifications, pelvic floor exercises, vaginal devices, some treatment to bladder, muscles and nerves, and we have safe and effective surgeries to offer to our patients in order to treat pelvic organ prolapse and incontinence.
A lot of important information out there. To find out more about all the treatment options and procedures Dr. Kirakosyan offers for women suffering from pelvic floor disorders, head over to their website at gppconline.com. Simply click on Urogynecology under the Specialties drop-down tab menu. He is part of the General Physicians PC Group and has office locations in East Aurora, Elma, Snyder, and Williamsville. You can give his office a call at 656-4077 to speak to his helpful staff. Now, coming up next, Amagon Funeral Home will be joining us to talk about the benefits of pre-planning a funeral and how it can make a difficult time much easier on a family. And a little later on, we'll learn more about how Insight Eye Care provides the most innovative treatment when it comes to your eyes. We'll hear more about all the eye care services they provide. Western New York Living will continue.
Special consideration for today's show paid for by the following: